Hello and welcome back to GP Video Podcast by Nadia. So we are still continuing with fatigue because it's a vast topic and I don't know how many more podcasts will it take me. I might give it a bit of break in between, but today we are still continuing with it. So as we have already decided that fatigue is a symptom complex and it is a feeling of exhaustion, tiredness or lack of energy, and it can be both mental and physical, and usually it is a combination of both. It has got four main classes of causes, and usually when a person presents with fatigue to a GP, they have a combination of causes from all of these four classes: mental health, physical health, lifestyle choices, lifestyle factors, and work-related issues. So we had covered everything else, but now we have come down to the medical causes, and in medical causes we said that number one is any malignancy. A doctor will try, and if he's suspecting the most sinistrous cause is malignancy, so he'll try and exclude any malignant reason present in the body, any cancer. So that's number one. Number two, we said that anemia may present with fatigue, so it's very important that on biochemical workup we exclude anemia. Then we have got the vitamin deficiencies, especially iron. Vitamin D and vitamin B12 are very, very important. Then we said sleep-related disorders. This is another main subcategory in the medical causes. Then we came down to endocrine and metabolic disorders, including thyroid disorders. Both hypo and hyper can cause fatigue. Parathyroid disorders, diabetes mellitus, adrenal insufficiency, hemochromatosis, which is a condition in which there is excess iron in the body. So see, both iron deficiency and excess iron in the body can cause fatigue, and obesity. Then we said kidney diseases, heart diseases, and chronic lung conditions can all cause fatigue. Then infections that actually lead to chronic infections or chronic symptoms, like let's say long COVID. This can cause fatigue. Then we come down to neuromuscular conditions, including multiple sclerosis, Parkinson's disease, or after ischemic or hemorrhagic stroke. So neuromuscular conditions can also cause fatigue. Then we come down to autoimmune and inflammatory disorders, including fibromyalgia, rheumatoid arthritis, systemic lupus erythematosus, polymyalgia rheumatica, and giant cell arthritis. All these can cause a lot of fatigue. Then deconditioning following a period of inactivity or reduced activity. Convalescence following surgery means post-op recovery period following surgery. Food intolerances. Yes, food intolerances can cause a lot of fatigue, celiac disease, lactose intolerance. Then the last one is medications. There are so many medications that if you are on them regularly, they can cause a lot of fatigue as well. So these were the broad main subcategories of the medical or physical causes of fatigue. So now we have covered all the causes. Now we will come down to another form of fatigue, which is called chronic fatigue syndrome. And we look into it, that what is chronic fatigue syndrome and how is it different from other causes of fatigue. Okay, now after talking about all the possible causes of fatigue, there is another condition called myalgic encephalomyelitis or chronic fatigue syndrome. Now what is it? It is a poorly understood but complex, debilitating and disabling condition. The lack of understanding of the pathophysiological basis of the disease and the absence of a universally accepted definition or diagnosing test makes it very difficult. For some reasons, research is also challenging and controversy exists and all of that. So basically, what they say is that this condition, which is called myalgic encephalomyelitis or chronic fatigue syndrome, should be considered in patients with unexplained disabling fatigue lasting longer than 6 months in adults or 3 months in children and adolescents, with the hallmark feature of severe post-exertional malaise. Symptoms are not improved with rest. So basically, the long array of all the reasons that I've told you, including mental health conditions like depression, anxiety, stress, conflicts with the family members, conflicts with the workplace members. So that in mental health, physical health, in which I told you so many subclasses, then lifestyle factors, then workplace related factors. When we cannot find anything in there, And then, but still there is an unexplained debilitating fatigue lasting for more than 6 months in adults and more than 3 months in children and adolescents, with the hallmark feature being post-exertional malaise. Like whenever you exert, like for example, if you do an exercise or if you do a house chore or if you do anything which needs physical exertion, and then you have a bad post-exertional fatigue which is not improved with rest, that is a hallmark of a condition called chronic fatigue syndrome. People with these often have co-occurring conditions, including autonomic dysfunctions, which can manifest as postural orthostatic tachycardia syndrome, POTS, and fibromyalgia. If you remember, I've already spoken about fibromyalgia, which is a condition, chronic pain condition, without any explainable, without any cause that can be explained. So basically, the people who have this chronic fatigue syndrome, or what was it? The name is very difficult. Myalgic encephalomyelitis. They usually have fibromyalgia as well, and also have another condition called POTS, which I will explain to you some other time because that also needs a fair bit of explanation. But we will talk more about chronic fatigue syndrome and the treatment and management of and investigation as well in next episodes.